the women who were menopausal, who were given just estrogen. These were women who'd had a hysterectomy, so they didn't have their uterus anymore, and they were given just estrogen hormone replacement therapy. They did not have an increase in the risk for breast cancer. So even though estrogen is the one that got the bad name, it was not the estrogen that was causing the breast cancer. The one that was causing the breast cancer was this synthetic progestin that we were using. And even then, it only caused a very small increase in the risk for breast cancer. But because we were telling everybody in America that they needed to take it, even a small risk wasn't really acceptable. But when we sit back and crunch the numbers, what we see is there was less colon cancer, there's less lung cancer, there's less osteoporosis, there's less hip fractures. So you were actually less likely to die if you were on the hormone replacement therapy than if you were not, even the small increase in the risk of breast cancer notwithstanding, and the fact that these were synthetics and not the natural bioidentical form.
Welcome to the Woman's Doctor podcast, helping empower women to embrace their body and soul's full potential. I'm your host, Dr. Trevor Cates, and after 22 years of working with patients, I found the answers to our health struggles are much deeper than most people realize. To help explore this, I'm interviewing colleagues and other wellness experts to get to the root cause so women can realize their true beauty and be informed decision makers for themselves and their loved ones. What are bioidentical hormones, and are they safe to use? These are two of the biggest questions I get asked by women in their perimenopausal and menopausal years. So that's exactly what we're covering in today's episode of the Woman's Doctor podcast. Who better to answer this than Dr. Deb Matthews, also known as America's Happy Hormones Doctor. Dr. Deb is a best-selling author, international speaker, educator, wife, and mom of 4 boys. After suffering for years with fatigue and irritability due to hormonal imbalances, her quest to resolve her personal health led her to change everything about her practice of medicine. She's been featured on numerous national podcasts, radio, and TV, including NBC, ABC, CBS, and Fox. She's also one of our featured experts in the Hormones, Health, and Harmony docuseries, which you can learn more about at hormoneseries.com. In today's podcast, we're delving into hormone replacement therapy and the pros and cons of each type. And we discuss how hormones shift through our 30s, 40s, and 50s, and how bioidentical hormones may be used as part of an integrative treatment plan during each of these decades of life. This and much more on today's episode of the Woman's Doctor podcast. Dr. Deb, it's so great to have you on the podcast. Welcome.
Oh, thank you so much. It's so great to be here with you.
Yes. And so I just want to go ahead and dive right in. One of the biggest questions I've been getting asked, especially after the Hormones, Health, and Harmony docuseries, is, are bioidentical hormones safe? Because we talk about them, but people still are wondering, is it okay for me? Is it safe for me? So, but before you answer that, can you explain for people who didn't watch the docuseries, what are bioidentical hormones?
Yes, bioidentical just means that the hormones are an exact match to what your body makes. So at least in theory, your body can't tell the difference between hormones that came from your ovaries and from the pharmacy. And that's really important because for many years, we've been using synthetic drugs in place of chemicals for women. And honestly, as a medical doctor, I didn't even realize that. We don't even realize that the hormones that we're giving women aren't real hormones. They are man-made synthetic drugs that are made to copy or mimic our hormones. So they have some of the same effects, but not all of the same effects. And therefore, they don't all have the same benefits and they have some extra risks. So to me, it seems pretty straightforward. If you are going to go on some kind of hormone replacement therapy, it just seems the obvious choice to choose the one that's exactly what you're missing instead of an imitation drug.
Yeah. Okay, perfect. Thank you. And so who are good candidates for bioidentical hormones?
Well, Women who are in the perimenopausal or menopausal time of their life, that's when we start to think about hormone replacement therapy. And at different ages, we actually have different hormones that are changing. And so we need different things at different ages. So maybe is it okay if we start with sort of women kind of perimenopausal and then go to menopausal? So women who are over 35, but aren't full on menopausal yet, the first hormone that changes is progesterone. And progesterone is the calming hormone. It helps us sleep. It helps us feel calm. And so when we start to lose progesterone, we start to feel more anxious and irritable, and we don't sleep soundly, and we just don't feel like ourselves. And often it changes with our menstrual cycle, so it gets worse before our period. And if this is the case, one of the things that we can do to help is we can offer back some natural bioidentical progesterone, and that can make such a tremendous difference in how women feel. I know for me, when I was in my late 30s, I was a little crazy. Like I would get so upset over things that seemed like such a big deal in the moment. And then a few days later, when my period started and things had shifted, all of a sudden I looked back and I thought, what was I thinking? And my poor husband didn't know what to do with me. And so when I started on progesterone, I just felt like, it was like nature's version of a glass of red wine, or, it's just so calming, and you can feel more in control and back to yourself again. And the question of safety here is it safe to take some natural progesterone? And the thing that women are most worried about when we say, is it safe, and hormones in the same sentence, is breast cancer. And what we know is that in premenopausal women, this time in our 40s, when we are perimenopausal or leading into estrogen, is actually a dangerous time for us in terms of breast cancer. Breast cancer is not caused by these hormones. It's caused mainly by toxins in the environment. So, right, we want our clean skin care, and we want to be avoiding toxins as much as we can. Toxins in the environment is the most common trigger for breast cancer, but it's also the environment in the breast. So if you have healthy breasts, then it's harder for cancer cells to flourish. And estrogen can help feed cancer cell growth, whereas progesterone can hinder it. So if you're a perimenopausal woman, you're still making your estrogen, but you're not making progesterone very well. This is estrogen dominance. Then if we were to supplement and put back the progesterone, we should be leveling the playing field. Otherwise, here you've got your foot on the gas with the estrogen, and you don't have your foot on the brake pedal anymore. So for premenopausal women, if we can balance their estrogen and progesterone with some natural progesterone, we ought to be reducing the risk for breast cancer. And it's very frustrating that the medical studies to really definitively prove that haven't been done. There's really no medical financial incentive for those studies to be done. And there's some disincentive because some of the more standard things that we use, like birth control pills, don't have natural progesterone. They're the drugs, and those drugs do not protect from breast cancer the way our natural progesterone does.
Yes. Okay. Thank you for clarifying that. It's so interesting. And progesterone has definitely played a role in my life too. I've definitely benefited from that, and including with my third pregnancy when I was 30, I took progesterone, and that helped me from because I had a miscarriage between my second and third pregnancy, and then I was put on progesterone and helped me have a healthy pregnancy the third time. So, and that was at 30.
Yeah. And it's
Yeah.
progestational. So it's one of the important ones to sustain a pregnancy.
Yeah. And there are lots of different forms of it, right? So there are creams and there are capsules and troches. So do you want to explain the difference between those?
Sure. So you can have, or we call it oral micronized progesterone. So the natural form of progesterone, the bioidentical progesterone in a capsule. And that we usually have women take at bedtime because it's calming. It helps with sleep. It helps us feel relaxed. We can also do topical creams, and the creams can be, just rubbed onto your skin. They can be used vaginally, and troches are like little lozenges that you dissolve under your tongue. And there's kind of pros and cons to each one. If you swallow the capsules, your liver processes it, and a byproduct crosses to your brain. It's called allopregnanolone. It's very calming. So if a woman's primary symptoms are like irritability and anxiety and insomnia, then the capsule can sometimes help more than the other forms. Whereas if bleeding is the primary problem, like heavy periods or, extended periods, progesterone actually helps to reduce the bleeding. It helps to minimize the thickness of your uterine lining so there's less menstrual bleeding. And that one, if we use the progesterone vaginally, sometimes can help even more than the capsules. So there's pros and cons to all of them. They're all bioidentical. They're all fine, but sometimes we might pick and choose a different form depending on somebody's precise symptoms.
Right. Okay. And what is the form of progesterone that people should stay away from?
Okay, there are many different synthetic drug forms of progesterone. We lump them together and call them progestins. So progestins are found in birth control pills. They are found in the depot shot, which is a form of birth control where women get a shot every 3 months. They are found in the general, synthetic form of hormone replacement therapy. There's even a progestin only birth control pill. And these progestins don't do the same thing as progesterone. So if you're looking for birth control, that's sort of a whole different conversation. But if you're having perimenopausal symptoms and you're just trying to feel better, then what you need is not one of the synthetic progestins. You want the natural bioidentical progesterone.
Yes, thank you. And it's also in some of the IUDs as well, right?
Some of the IUDs have low doses of progestins too. Mm-hmm.
Okay. Cause I know that some of my patients have come in and say, oh, I've got progesterone in my IUD. And I'm like, well, let's clear this up.
Yeah, not the same thing by any means.
It's not the same thing. What are some of the problems that you see or have heard about with progestins?
Well, so progestins were studied to see what they do to our uterine lining and to prevent pregnancy. Those are the things that they were studied for. And they weren't really studied for breast health. And so progesterone helps with breast health, helps minimize chances of breast cancer, but progestins do not. And specifically, there is the form of synthetic progestin that we gave to women for part of their menopausal hormone replacement therapy. And that particular one, called medroxyprogesterone acetate, is the one that was associated with an increase in the risk for breast cancers. So when I was in medical school in the 90s, what we were taught is all women who go through menopause should go on hormone replacement therapy for their own good. It's going to protect your heart and your brain and your bones. And when you didn't, as a woman, go on hormone replacement therapy, we as doctors were very upset with you. It was very paternalistic. We thought you should be on those hormones. And we gave every woman the exact same dose. And for some women, it was too much and they felt miserable. And some women, it wasn't enough and they didn't feel good. But that was how our thinking went. And then there was this great big study that came out 20 years ago that showed that the hormones were causing women to have breast cancer. And this is what terrified everybody. And doctors told women to stop hormones, and women were terrified to take their hormones. So a whole generation of women went off their hormones in droves. And now that we've had 20 years to think about it rationally, here's what we really know about the hormones. Is the women who were menopausal, who were given just estrogen. These were women who'd had a hysterectomy, so they didn't have their uterus anymore, and they were given just estrogen hormone replacement therapy. They did not have an increase in the risk for breast cancer. So even though estrogen is the one that got the bad name, it was not the estrogen that was causing the breast cancer. The one that was causing the breast cancer was this synthetic progestin that we were using. And even then, it only caused a very small increase in the risk for breast cancer. But because we were telling everybody in America that they needed to take it, even a small risk wasn't really acceptable. But when we sit back and crunch the numbers, what we see is there was less colon cancer, there's less lung cancer, there's less osteoporosis, there's less hip fractures. So you were actually less likely to die if you were on the hormone replacement therapy than if you were not, even the small increase in the risk of breast cancer notwithstanding, and the fact that these were synthetics and not the natural bioidentical form. But the fear of breast cancer is so ingrained in women. And the message that I really want to get across is the natural form of progesterone has not been shown to increase the risk for breast cancer the way that the synthetic progestins have. So there really is a difference between what form of progesterone we're giving to women when we think about their risks for breast cancer. And it's kind of shocking to hear that it's really not estrogen that's the one at fault. And I think the reason that it's so confusing is because women are always told when they have breast cancer, the first thing we look for is it estrogen fed? because if it's estrogen fed, then the oncologists choose different treatments than if it is not estrogen fed. But even if it's estrogen fed, it doesn't mean that it was caused by estrogen. It just means that those cells have estrogen receptors on them. And so estrogen will tell those cells to grow, just like estrogen tells all breast cells to grow. And so that's, I think, really confusing to women.
Yes. Oh my gosh. Thank you for clearing that. It's so important for people, women in particular, to hear this, but all people to hear this. And I really hope that doctors will start understanding this too, because they're the ones. I think a lot of doctors are still like, stay away from hormones
Yes.
and they're dangerous and all hormones are the same and there's not enough research. And I think so many women could be benefiting from bioidentical hormones as they go through perimenopause and into menopause, and they're struggling and they're suffering and they're thinking the best thing to do is to just not take them, and
Suffer
that they're doing
through. Yeah.
doing things that are good for their health by avoiding them. And it's like this badge of honor. I hear a lot of, even like my girlfriends are like, oh, well, I don't need them and I'm going to stay away from them and I'm going to, like do natural things. And I'm like, well, you might actually benefit from it.
Yeah.
Yeah.
And I think it's important that we shouldn't be the old way, paternalistic,
Right.
everybody needs it, right?
Yes.
This should be an individual choice. And just like everything, there's risks and benefits with everything. And we all have our own personal histories and, our own personal health risks. So this really needs to be a conversation between women and their providers, so that the best choice can be made for them. And it's always a choice. That's the good thing. Hormone replacement therapy is always a choice, so you don't have to do it, and you can stay on it or you can stop it whenever you want. It's not like it's addicting, or you can't discontinue at some point. But it's true that there are a lot of doctors who are just, they got burned in the past, they got scared, and they feel safer. They personally feel safer by just saying, don't do it, because they're worried. And I think that's really a shame. I think that women suffer unnecessarily. And one of the things that I hear doctors telling women a lot, I guess there's two myths that I'd like to dispel, if that's okay.
Absolutely.
One of them is you can only be on hormones for a short time and then you need to stop. So I've had women tell me that their doctor told them they can't have hormones because now they're 60 or 65. And that's just not true. So where that came from, because we used to tell people to stay on it, but it came from the fact that these doctors believe that they're giving women a pill that's going to increase their risk for breast cancer. So of course they want them to come off it as soon as possible. But if you're on the natural bioidentical form of the hormones, which don't have the same kind of risks for breast cancer, and I'm not saying that a woman can't get breast cancer anyway. Hormones are not, we're at risk for breast cancer. We need to take care of our health. It can still happen, but it's not increasing the risk. So when women are the North American Menopause Society, which is, all the regular gynecologists and family doctors, et cetera, their most recent position statement says that if a woman is getting benefit, if it's helping to prevent painful sex and vaginal dryness and osteoporosis, et cetera, then it's okay to stay on the hormones. She doesn't have to come off. The other myth that I hear that keeps women away from hormones is that their doctor says, you're not a candidate for hormones because your mom had breast cancer. So it's a different story. Like, I think everybody knows about Angelina Jolie, and her mom passed away young and her grandmother passed away young. They had breast cancer. There was ovarian cancer. They have the gene, the BRCA gene. So that's one category of people who have a very strong family history. So if your mom and 4 of her sisters and her mother and 6 of her sisters all died of breast cancer, well, that's a very different story than if your mom is the only person in the family who has had breast cancer. So just because your mom had breast cancer, it doesn't mean that you're not a candidate. It means that, we need to think about the risks and the benefits. It means that you need to be taking care of yourself and doing the things to keep yourself healthy. But it doesn't automatically mean that you can't, and that you have to suffer with hot flashes and insomnia and bad memory and exhaustion and, painful sex and bone loss and hip fractures and dementia and all the other things that go along with hormone deficiencies.
Yeah, absolutely. Okay, thank you. And that brings up another question that I was asked after the docuseries a lot, which is for women who have breast cancer or who have been treated for breast cancer, they're being told that they have to completely stay away from hormones. And then some women who've had a hysterectomy and had breast cancer and they have no hormones. What do they do about that?
Yeah. Okay. So this is super duper controversial about if you have never had breast cancer, that's one whole story. If you personally have had breast cancer, then this is the wild, wild west in terms of doctors disagreeing with each other. We have some studies that actually show that women do fine with hormone replacement therapy after they've had breast cancer. But when you have breast cells, breast cancer cells in your body that are estrogen fed, the concern is if we give you hormones, will that cause those breast cancer cells to grow and divide? So the party line amongst sort of the conventional doctors is absolutely not. No hormones, no way, never. But all hormones aren't created equal. And there are some things to take into account. So here's some examples of ideas. If you have breast cancer and you're suffering with hormonal symptoms, estriol is a form of estrogen that does not cause breast cancer cells to grow, but it's actually very helpful for vaginal dryness. So it's something that can be used to help with those symptoms. And more, I see that doctors are willing to give women vaginal hormones even if they've had breast cancer, at least in order to help the vaginal dryness and painful sex and urinary leakage and things like that. So even if it's not full-blown hormone replacement therapy, there are things that we can do to help those particular symptoms. Another thing that I have seen some doctors do is use testosterone for women, because we haven't even gotten to talk about testosterone yet, but testosterone is another really important hormone for women. And testosterone helps to keep your bones strong, and it's motivating and energizing, and it's good for libido and vaginal lubrication, and it just keeps your brain sharp, and it's good for anxiety and depression. So it's got lots of really great benefits for women. And testosterone does not promote breast cells to grow in the way that estrogen does. And so there are some doctors who are actually giving women testosterone with the, okay of the oncologist involved. And so sometimes that can make a really big difference, even if estrogen isn't going to be on the table for you. So it's one of the things that's really difficult here is we don't want to do anything that's going to increase risk. Even though studies are starting to come out now to show that it might actually be okay for women to be on hormones if they've had breast cancer, it's a very big liability risk for the doctor in terms of getting into trouble for prescribing hormones. So it puts doctors into a really tight spot. But what we do know is there's so much that can be done to optimize hormone health without taking hormone replacement therapy. And so here's where we want to do all the things to help optimize stress and nutrition and avoid toxins and get exercise and maintain your weight, all the things that we know are going to help you to feel better. Because at the end of the day, even for women without breast cancer, we always want to put the hormones in a healthy body because we want the benefits of the hormones, not the risks and the side effects.
Yes, thank you for bringing that up. I definitely wanted to touch on that or go into that, in that I personally never would just put any woman on bioidentical hormones without first talking about what are you eating? Let's clean up your diet, what supplements you might want to take to fill in the nutritional gaps that you might have. Let's do some testing to see how your body, your metabolism, your genetic risk factors, all of these things. And so, and looking at hormone metabolites and things that, because we want to optimize our health anyway. And then, of course, and so I think I do get concerned when women are just put on bioidentical hormones and all the other supportive things aren't done. So I definitely I'm glad that you brought that up.
Yeah. So for me, when I treat patients, we always look at the whole person, and the hormones are just a piece of it. We need a healthy gut. We need proper detox pathways. We need the good lifestyle habits, and the hormones are the icing on the cake. And so if all that happens is you walk into the doctor and you walk out with a prescription in your hand, bioidentical is better than synthetic, but nonetheless, there's so much more available to help you feel your best and get the most out of the hormones.
Yeah. Okay. Absolutely. Okay. A couple of other myths that I hear that I want to help bust. One is the question is, can I, if I'm in menopause now, women will say, if I'm in menopause now, can I take bioidentical hormones or is it too late?
Yes. So there was a theory that we called it the timing hypothesis, that what we saw was women who were within 5 to 10 years of menopause, if they started on hormone replacement therapy, clearly the benefits of the hormones outweighed the risks. So this is mainstream medicine now. That's not just, the holistic doctors talking here. Mainstream medicine believes that for the average woman starting on hormones within 5 or 10 years of menopause, the benefits of the hormones are very significant and outweigh the risks. The question comes, what if you're more than 10 years out from menopause? And what was found is women who were given the pills that weren't bioidentical, that there may be some increase in the risk for blood clots, which can cause a stroke or a heart attack. And the older these women were, the greater the risks for those things. But what we know is that if we use the hormones topically instead of as a pill, we don't see the same kind of blood clot risks. And it's estrogen and the blood clot risk here, not the bioidentical progesterone, but yes, the synthetic progestins add to the blood clot risk. So that's why the form of hormones, if they're bioidentical or not, and how we give them, whether it's a pill or topical, or, there's all different ways we can do it. But those things actually really matter. So the concern was, if we start women on hormones when they're older, is it going to cause more harm? And what we know is, if you wait and you're more than 10 years after menopause and then you start the hormones don't go backwards and erase all the, aging process that's happened. But I feel comfortable prescribing hormones to women, even if they are a little bit older, because no matter how old you are, it can still help your bones. It can still help with vaginal dryness, urinary leakage, painful sex. Like, there still are benefits. I might choose different ways of doing it. You might need a lower dose if you're older. We might use a gentler touch, but it is really a myth that you can't have hormones at all simply because of your age.
Great. And that goes the other way too. I mean, I think I've heard women say, I'm too young for bioidentical
I
hormones.
hear that a
And so,
lot.
right. And so, what would you say would be the youngest patient that you've had that you put on bioidentical hormones? I mean, and it's probably progesterone, like we've talked
Yeah,
about.
yeah. So even like young women. So if we go all the way to the beginning, like puberty, one of the challenges when teenagers go through puberty is that when they get started on their periods, they're not ovulating regularly. And so when they're not ovulating regularly just yet, they don't make progesterone. And so sometimes they can have really heavy, painful periods because progesterone would make their uterine lining not quite so thick. So while I don't do this routinely, I have actually used natural progesterone on teenagers in order to help them have more manageable periods, as opposed to birth control pills, which is what, is the conventional treatment for it. And it's important, teenagers, progesterone is not birth control. So there's lots of pros and cons that have to go into that sort of a conversation. But for women in their 20s and in their 30s, even if it's not perimenopause, if there's some reason why they're not ovulating, we obviously want to find the underlying reason. We don't just want to give a prescription, but sometimes adding some progesterone as part of a holistic treatment can actually benefit. But what I see a lot is women who are in their mid-30s and they have all these symptoms of estrogen dominance, the heavy, horrible periods and the terrible PMS that's going on, and the insomnia, the anxiety, the night sweats. And when they go to their doctor to say, like, surely it's got to be my hormones, the doctor looks at this 30-something-year-old woman and they're thinking of menopause. And so they don't want to measure their hormones, right? They just tell them, it's normal, or they give them an antidepressant, and it's so frustrating because this is something solvable. You don't have to put up with feeling that way.
Yeah, thank you for saying that. And that's, what we really dive into in the Hormones, Health, and Harmony docuseries. That's why I wanted to do a whole 9-part series on it, because there are so many different ways that our hormones play a role in our health throughout our lives. And it's not just about menopause, but certainly menopause is another time we want to, and it makes the transitions easier if our hormones are balanced, right?
Yes.
Well, so we've talked a lot about progesterone, and we touched on testosterone. I'd love to know, and we have talked some on estrogen, but we were kind of talking about different ages of a woman's life and what hormones are when they start to change. Before you talk more about estrogen, you mentioned to me an interesting fact about testosterone. Can you share that with the audience?
So, a little known fact is that women actually have 10 times more testosterone than estrogen in our bodies. And we use testosterone to make estrogen. Now, men have 10 times more estrogen than women, but that's interesting that doctors and women kind of know estrogen, but a lot of women are low in testosterone, and that's not something that's ever even considered.
Mhm. Yeah. So, okay. So we talked about progesterone as the first hormone that really starts
Yeah.
to drop and especially in a woman's 30s and then into her 40s. So then what about what happens with estrogen in relationship to progesterone?
So even the testosterone is often low in the 40s, but for estrogen, sometimes in that same time frame, in the 40s, estrogen gets erratic, and sometimes it can actually go up before it ultimately drops down at menopause. The average age of menopause for women is about 52, and menopause simply means that it's been a year since you had your last period. And so sometimes women can have relatively more estrogen as they're, going through their 40s, and then at some point it's going to drop off. So when we're in our 50s, that's often when our estrogen level drops, and then that's when we may want to think about adding some bioidentical estrogen.
Okay, great. All right. Well, we have covered so much today. The last thing I want to ask you about is, I think a lot of times we focus on the skin up here, but there's also skin down there that changes as we get older and as our hormones fluctuate. So could you share a little bit about that?
Yeah. So we can see on our face, right, that sometimes we get more wrinkles and more drooping, and nobody likes that. But on our skin, in our, female parts, in our intimate areas, the skin changes too. It gets thinner, it gets drier, it gets less elastic. And so while we can't always see everything on the inside, it really makes a big difference. So that's when we end up with the vaginal dryness. We can get more, we call it friable, meaning it's more delicate, it's easily damaged. So it's not springy and juicy and elastic like it used to be. And this can really be uncomfortable. It can just be uncomfortable on a daily basis. It can definitely be uncomfortable with intercourse. It can change sensitivity, so it's very difficult to become aroused. And these hormones all play a role. So estrogen and progesterone and testosterone are all very important for keeping vaginal health optimized, for keeping our urinary tract healthy. So a lot of times when these areas just kind of get looser and they're just not toned and tightened like they used to be, it's easier for us to get urinary tract infections. The bacteria can kind of creep its way up where it's not supposed to be. We get more urinary leakage. And up until now, there hasn't been a lot that has been done about those things, but hormones can really play a role in toning and tightening and lubricating and keeping the hydration in there. So one of the things that I see a lot is women may go on hormone replacement therapy with their doctor for estrogen and progesterone, but often the testosterone is missed. And sometimes that's the secret sauce that can really make the difference. So if you are a woman on hormone replacement therapy and you're still dry and not feeling quite right, think about testosterone.
Great. And there's also DHEA as well, which we
And
haven't.
DHEA, that's right. And DHEA is actually available over the counter. And so that can be used actually as a cream vaginally. And this is a hormone that your body uses as a precursor, as an ingredient for estrogen and testosterone. And so that's certainly something that women can try.
Awesome. This has been so fantastic. Dr. Deb, thank you so much. Tell everyone where they can find you, learn more about you.
Yeah, so my website is signaturewellness.org, and there's lots of information and blog posts and all kinds of things there.
Okay, great. Thank you so much for this information today.
Thank you.
Thank you for listening to the Woman's Doctor podcast. If you enjoyed the podcast, be sure to share this with the women in your life and rate and review this show.